That was good, though.
Next up would be SB 137, Senator or Mr. Chairman Hernandez.
Good afternoon, Madam Chair and members. California shopping for health insurance must have confidence in provider directory information in order to make coverage decisions. Most of the population is required to have health insurance. More and more, we expect patients to be smarter consumers. Insurance products are designed to shift more costs to consumers to give them skin in the game. But without accurate information, healthcare consumers cannot make decisions that are in the best interest of their health or their wallets. This bill, SB 137, is a simple bill to make sure health insurance provider directories are accurate. The bill also creates uniform standards so that search tools can be used to easily determine which products a person's provider participates in. I'm working with the plans on the concerns they have raised about the bill. Danielle Nelson from South Orange County has agreed to share her story with the Senate Health Committee as one example of the problems that exist today. Cindy Young is also here to specify examples, specific examples. I do have technical amendments that are being passed out. Thank you, and I respectfully ask for an aye vote.
Thank you. Witnesses in support?
Good afternoon. Betsy Umholtz for Consumers Union, the policy and advocacy arm of nonprofit Consumer Reports, and a proud co-sponsor of the bill. The world of healthcare has changed dramatically with the ACA. 3 million Californians now newly covered, and a greater need for them to shop for coverage. So it's more important than ever that they have accurate information. Consumers Union has gotten scores of stories from people who are delighted with the new coverage that they've gotten, and other people who've had problems figuring out who's in their plan network so they can get the best quality care for the best price. Danielle Nelson from Orange County is one of those people, and she's with me today to tell her story to illustrate why this bill is needed. Thank you.
Hi, as mentioned, I'm Danielle Nelson, and I am a stay-at-home mom and a mother of 2 small children. My husband is an independent consultant, so we need to get our health insurance on our own. In March 2013, I was diagnosed with a treatable but incurable blood cancer. 3 months later, I learned that my health coverage was going to be discontinued at the end of the year. As upsetting as that was, I was extremely relieved to learn that I was not going to be denied health coverage because of my cancer, and that I was going to have many choices in health coverage and health plans due to the new exchange. I spent that fall using Covered California's website to verify which plans included my family's doctor, specifically my specialized oncologist. I found inconsistencies with what was listed on the website's provider directory and then when I talked to the doctor. In November, the exchange's website started linking directly to the insurer's providers directory. In trying to ensure that my doctors were covered in a plan, I would check the online directory, call the insurance, and check with the doctor, and still the insurance provider directories were proving inaccurate. In late November, as recommended by the exchange, I contacted an agent with my preferred carrier. He confirmed that most of my doctors were covered under my desired plan, most importantly, my oncologist. I spoke to the agent several times over the next few weeks, confirming this information, and by mid-December, I purchased a plan, and I was very excited to be done with 2.5 months of hard work and stress, all while dealing with the overwhelming anxiety of having an incurable cancer. Barely a month later, I noticed lumps in my neck, went to my doctor, and learned I needed to have treatment right away. Within 2 hours of the appointment, the doctor's billing department called me to say they do not take my insurance. So here becomes the most agonizing 2 months of my life, having to start chemotherapy and not having the health coverage I had worked so hard to secure. Now I'm facing a crisis, and I got to start all over again. Checking insurers' websites, talking to their representatives, calling the doctors, working through the inconsistent provider directories. I finally came up with my own plan, and I just called the insurance companies with the tax ID of the doctors to get some kind of accuracy. So in the end, I did finally find replacement coverage. There are so many people like me dealing with the devastating diagnosis of cancer. Buying insurance is supposed to provide you peace of mind that you'll be taken care of in your time of need. I trusted my insurance carrier to give me an accurate provider list, and in my time of need, they failed me. Please don't let them fail anyone else. Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network. We're very happy to be co-sponsors on SB 137. I just want to emphasize the importance of this measure from a health equity perspective. Communities of color often face insufficient distribution of providers, transportation barriers, lack of flexible hours, and language barriers. So any errors or inaccurate information in provider directories is another barrier to accessing healthcare, causing delays, requiring excessive travel, and preventing patients from finding a provider who can meet their cultural and linguistic needs. So it's very important to ensure that directories are accurate and up to date. And I also want to note the importance of reporting languages spoken by providers and their staff. Language barriers, as we know, cause a number of issues, risk of misdiagnosis, misunderstandings, and it's especially important for LEP patients to have linguistically appropriate care. And many plans are providing some of this information in some way, but since state and federal laws vary on these requirements, it's very important that this bill sets a standard for it and it clearly notes that that information ought to be included in provider directories. So we're very happy to be here in support and urge your aye vote. Thank you.
Beth Capel on behalf of Health Access California. Last fall, as we were considering what to do in the wake of numerous individual consumer complaints about lack of accurate provider directories like the one you've heard today, Cindy Young, who works with John Glynn and Company, who we've worked with over the years, they work on providing healthcare consulting services to school districts, and she was here earlier but could not stay to this hour. You have received letters from the Montebello Unified School District and the El Rancho Unified School District, which relied on the provider directories that were provided to them by their health plans, and specifically relied on them with the understanding that a particular hospital, Presbyterian Intercommunity Hospital, was in the provider directories. The letters you've gotten attach copies of the directories. They discovered after they had switched people to the lower cost plan with this particular health insurer that indeed Presbyterian Intercommunity was not available to people in the lower cost plan. It was only available for emergency care. Well, of course, as the members of this committee know, as a result of EMTALA, every hospital is available for emergency care. So listing a hospital in the directory simply because it has an emergency room is the equivalent of bait and switch. The school districts have ended up spending over one of the school districts ended up spending over $100,000 to pay for the more expensive product to include the hospital they thought was included in the less expensive, narrower network. No one here objects to narrow networks. We object to inaccurate characterizations of networks. This bill builds on the work that was done last year, SB 964, which helped to provide better reporting on network adequacy and timely access. It's important for consumers today to know. It's also important for purchasers who are making those very tough decisions to switch to lower cost plans to know whether their employees will be able to have the access to the doctors and hospitals they think are in the networks. For those reasons, we're pleased to co-sponsor the bill.
Thank you, Senators. Julianne Broyles here on behalf of the California Association of Health Underwriters. Our folks are the license agents, and they aid consumers, individuals, families, and employers find coverage. One of the most frequent things that we hear from our members is that the provider directories, when somebody is looking at selecting or renewing coverage, are not accurate. They do want to know if their doctor is in it. They do want to know if a hospital in their area is also in coverage in the plan. We agree with the points that this bill is trying to cover and would ask for your aye vote.
Please, go ahead.
Michelle Cabrera with SEIU California in support.
Jasmine Gordon with the California Black Health Network in support.
Jerry Jeffy, California Chronic Care Coalition, support.
Dolores Duran Flores with the California School Employees Association in support.
Autumn Ogden with American Cancer Society Cancer Action Network in support.
Kat New on behalf of the Southeast Asia Resource Action Center in support.
Megan Allred on behalf of the California Dental Association, and though our letter did not make the deadline for the analysis, we just wanted to come and show our strong support.
Kim Tice, Leukemia and Lymphoma Society, strong support.
Mike Carpenter, CHI, support.
Angela Blanchard on behalf of the 7 California affiliates, so Susan G. Komen for the Cure in support.
Sean South on behalf of the California Primary Care Association in support.
Sarah Flox, California Labor Federation, in support.
Scott Steele, I'm the father of a leukemia survivor and a volunteer with the Leukemia and Lymphoma Society, and we're in support of the bill.
Cheryl Johnson, Manager of Patient Access and Education of the Sacramento chapter of the Leukemia and Lymphoma Society, in support.
Teresa Anderson on behalf of California Academy of Physician Assistants, in support.
Jody Hicks on behalf of the California Academy of Family Physicians, in support.
Amy Taylor, as a mother of 2 special needs children who spends a lot of time dealing with insurance companies, I support.
Elizabeth Landsberg with the Western Center on Law and Poverty, in support.
Seth Bramble on behalf of the California Teachers Association, strong support.
Any other support? Any opposition?
Come up here.
Good afternoon. I'm Jennifer Gabals with the California Association for Health Plans, and we'd like to thank the author and his staffers work with us on this bill. We are not in opposition, but we do have some concerns that are technical in nature. Health plans have a vested interest in their enrollees utilizing their provider directories to ensure access to care. Our concerns are technical in the sense that other aspects of healthcare are updated on a monthly basis. Capitated payments are made on a monthly basis. Contracts start and begin at the beginning and the ending of a month. And so we think and the federal regulations for the provider directly also require that they be updated on a monthly basis. So we would like to see that, that the requirement be that the directories, to be more consistent with other aspects of healthcare coverage, that they be updated as monthly as well. We're also concerned about the 97% accuracy rate of the directories. Not because we don't think that we can create accurate directories, but a lot of the information is dependent on information that we get from the practitioners that we contract with, and the availability and timeliness of that information can be difficult for us to receive from them. So we'd like to see more of a stronger component for the shared responsibility that we have with our practitioners and making sure that the information that we receive from them is timely. So thank you again for our opportunity to make our comment.
Thank you. Members, Senator Manning.
Thank you. Really more of a comment, but I want to thank the author for bringing this forward. I know in my district, I'd say the biggest complaints, the largest number of complaints we've received for the 4 counties I represent are inaccurate provider lists. And I also just want to thank the woman who traveled here today to share your story with us. It was very compelling, and in your willingness to spend a day coming up here to share the story. I just want to thank you and wish you and your family the very best, and hope that through this vehicle and this legislation we can make sure somebody else facing the challenges you are doesn't have to face the added burden of being directed in different directions. So thank you for being here today.
Senator Nielsen.
Yeah, Mr. Chairman, I certainly am in sympathy with the bill, but I'm struggling with a little bit here because the provider and the plan, I'm pretty familiar with the provider side and the burdens that they face, and there's quite a bit of burden here in terms of providing information, and I'm wondering if on a weekly basis isn't a little bit too frequent for them to handle, but more importantly, if a provider does not provide the information to the plan, what is the sanction? I mean, I don't see any penalty.
Right. Well, with regard to the 1 week, I believe concerns that was to the 1 month, what we're basing this on is the emergency regs by CDI, which does it on a weekly basis. So most plans are already required to provide that information to CDI. Okay. Because we're in an electronic age, I think it's achievable. With regard to the provider, it's the plans that are having to reach out to the providers to verify. Now, with the providers, the only way, they won't be disenrolled from the plans, but if they don't bill after a 3-month period, then they're not listed on the plan, but they're not taken off the plan whatsoever. But I have heard it loud and clear, especially from the various plans, about the shared responsibility, and we need to look at to make sure that the providers, communicate back and forth to make sure that there is, a collaboration, but we haven't looked at any kind of sanctions for providers at this point.
Well, I've kind of been involved in this in other areas in the past of how you sort of, through moral suasion, if not full force, get people to cooperate. I would suggest, Mr. Chairman, that you do seek some opportunity for fostering and encouraging or rewarding, maybe rather than not punitive, but that collaboration, because if we don't have it, this thing's going to break down, I think.
Well, maybe we can do higher reimbursement rates if they cooperate.
We wouldn't even be here on this bill if that'd been going along for a time, huh? I'll think of some ideas if I have any, Mr. Chairman.
I'd be more than happy to listen to them.
Thank you. I just have one, just a comment, Mr. Chairman. I'm also concerned with the weekly reporting because accurate directory also involves, when it comes to providers, just because you're on the list doesn't mean you are accepting new members or patients as well. So that's whereas with providers in terms of the doctor's office and et cetera, just because you're on the list, you don't know your capacity until, a few weeks from now. You don't necessarily know it every week on what your capacity is in terms of being able to accept new patients. Not talking about the current patient you already have, but directory to me has to also include, are you accepting new patient or not? Because as a mom, I would call and go, wait a minute, I need X doctor. And then I call, they're not accepting, but they're still on the data or listed as, provider. And so I think, that's where my concern is, as much as I want them to do it weekly, because, when you need the doctor, you need a doctor. You don't wait till, 3 weeks. But how accurate can it be if it's weekly when the doctor's offices don't even know themselves if they're accepting new patients or not?
Right.
So that's my concern at this time.
Yeah, and I can address those concerns, and I think some of those have been addressed last year with a bill that I ran that specifies specifically if a provider takes new patients, which doesn't require that they report that weekly. This is just to verify that there's still members actively still on the plan, and maybe Beth could kind of expand on that as well.
Yes, through the chair. SB 964, which was enacted last year and which is already in effect, one of the things the reporting is doing for the first time ever is to report on whether physicians are accepting new patients for that network. And that there's been a collaborative process that the Department of Managed Healthcare has engaged in that's involved the providers and the plans and the consumer advocates to try and go through an iterative process to identify exactly the problem that you're talking about. Is the provider accepting new patients, as well as they can be in the network for old patients, current patients, thank you, ma'am. For current patients and not necessarily be accepting new patients. A number of the provider directories that we have looked at distinguish between providers who are currently in the directory and those who are in the directory and those who are accepting new patients. It's actually a very helpful thing for any of us dealing with a family member who needs care. And I think we're trying to get to this real life situation of patient, whether it's parents like yourself or patients like this one, or the school districts who reached out to all of us to share their experience about which providers are actually in the directory and which are actually really seeing patients, because simply seeing people in the emergency room doesn't really count. Thank you.
Thank you. Well, there's a motion. This would be due pass as amended to appropriation. Please call. Roll.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Mitchell, aye. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
5-0.
Can you put that on?
So we'll leave it open. We'll hold it open.
We're going to let Senator Mendoza
Okay, Senator Mendoza?
Oh, did he leave?
Oh,
Okay, then I guess I'll do mine again, my last one.
SB 147, Mr. Chairman.
Thank you, Madam Chair. Members, this bill would establish a pilot program that would change the way Medi-Cal pays federally qualified health centers, also known as FQHCs, in participating counties. This bill would replace the existing per-visit Medi-Cal payment methodology with a capitated system through Medi-Cal managed care plans using the alternative payment methodology, option authorized under federal law. The capitated payment would provide greater flexibility in healthcare delivery for the FQHCs by enabling them to provide different types of healthcare services without having to meet the per-visit billing requirement to generate Medi-Cal revenue. For example, an FQHC could use the capitation payment to provide a patient with different services on that same day. For example, such as physical health visits and a mental health visit, or to provide the healthcare services through different means such as phone consultation and email consultation, or through different provider types such as a dietitian. This bill is sponsored by the California Primary Care Association and the California Association of Public Hospitals and the health systems of LA Care Health Plan. The sergeants have distributed a mock-up that makes clarifying changes identified in the committee analysis. And with that, Madam Chair, members, I respectfully ask for an aye vote.
It's Senator Hernandez. Seems like on both sides, there seems to be agreement. If you can, please go ahead and state your name and support.
Doug Kim, my client, the Primary Care Association, is co-sponsor, and I have with me Andy Patterson. If you have any technical questions, we respectfully request your aye vote.
Hi, Andy Patterson with the California Primary Care Association, a proud sponsor of SB 147. CPCA represents 1,100 community clinics and health centers and 5.7 million patients in California, over nearly 50% of whom receive Medi-Cal coverage. We just wanted to take a moment to thank the senator once again for having the visionary leadership to author this bill. Once enacted, we will be the second state in the nation paying health centers through this innovative methodology. And we'd also like to thank the senator and his staff for pushing us to make this bill better than it was last year and working with all the stakeholders. And we think all of that hard work has materialized before you, and we think that this bill is better so that it can be a win-win-win for California, and we are committed to making it work. I encourage you to vote aye today. Thank you.
Good afternoon. My name is Sherry Fields with LA Care Health Plan. We're the health plan in Los Angeles County, serving over 1.6 million Medi-Cal beneficiaries. We believe that this pilot will help the state achieve the triple aim goal as outlined in the Affordable Care Act by testing and evaluating new payment methodologies. And we believe that this pilot will improve the healthcare delivery system, not only for the state and the clinics, but most importantly for Medi-Cal beneficiaries in California. Thank you.
Good afternoon, Sarah Muller with the California Association of Public Hospitals, and thank you, Mr. Chair and honorable members of the committee. California Association of Public Hospitals represents 21 different systems that collectively serve over 2.8 million patients every year. In addition to hospitals, they also operate over 100 clinics. Many of them are federally qualified health centers. We are proud co-sponsors of the bill today as well, and we believe the bill will help really accomplish three key goals. First, it aligns FQHC financing with how care is delivered. The pilot moves FQHCs into a capitated payment, a direction that is consistent with Medi-Cal expansion of managed care and many of the state's broader goals around aligning financing, quality, and outcomes. Second, it improves care for Medi-Cal patients. It will allow FQHCs to provide care in different types of settings, expand team-based care, and do a lot of things that we'd like to do, but our financing right now doesn't allow for that. And third, it creates a model for evaluation. This is a pilot. It will allow us to test new approaches and expand some care in different ways, and we can learn from those lessons and be able to continue to make improvements in care to our patients over the next 3 years. And will include a robust evaluation. We're excited about this opportunity, and we are committed to continuing to work not only with the senator, but also with all the stakeholders involved so that we can successfully move this effort forward and get it off the ground. Thank you.
Any more witnesses in support? Any opposition? Colleagues?
Move the bill.
There's a motion. This is due pass as amended to appropriations. Please call for the vote. Oh, and would you like to close, Mr. Chairman?
Pass when I vote.
Sorry, thank you.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Roth, aye. Wolk.
Aye.
Wolk, aye.
Do you pass? 7-0. So we're not open. We'll keep it open? Thank you. Sorry.
We're going to move on to item number 13, SB 648, Mendoza Healthcare Facilities Referral Agencies.